Any big epiphanies or insights after you left here yesterday that anyone wants to share?
Well,
Mark, surprise.
well, I just felt like I've grown a lot in a day. I mean, what I mean by that is a concept that was kind of hard to kind of wrap my head around. I think toward the end of the day, I started kind of getting it.
Yeah. Well, according to Tanya, you hit a home run, grand slam. You are the winning spirit of Cleveland now.
So that's kind of how I felt.
Great. Anyone else? The monitors a little temperamental today. Okay. So back to our arc here. So yesterday was culture, today's climate, and tomorrow will be accountable actions. And today what we want to do is deepen our understanding of climate, take charge of climate through what we call enabling structures. Right? And it's just a fancy way for you being able to say, the reason why we're going to build school climate like this, you actually do build climate, you influence culture, you actively build climate. Enabling structures are just really knowing why you're doing the things that you're doing around some key dimensions. And then creating an initial plan for moving forward. And this will be a draft plan similar to your culture statement. Plan is a little bit of a misnomer because the plan will be tomorrow. Okay. So I'd like to start off with this today. Just take this is also in your packet here. You should have a day 2 handouts. It's thinner than yesterday. Oh, and just a reminder, so I should have said this before. So through the morning, we'll kind of work on the climate stuff. We'll go to lunch, and then we'll come back. And remember, today we're ending at 2, so we're going to pick up the pace a little bit more just to make sure that we have enough time for it. Okay, great. All right, take a look at this quote. Read it. Think about it just for a second. Just as it relates to your own work.
Smartest, you don't have to be the best and brightest, you got to at least try
Okay.
You don't practice that. It's not good.
What'd you guys think? Ben?
Basically, it just says you don't have to be the smartest or, you know, the best and the brightest, but you have to try and you have to basically try hard. We've all been in schools. You know, we may not have been the most successful, but you know that if you really want to do something, you can get it done. You just got to make sure that you put forth the effort and the follow-up to it.
Do you believe this?
Oh, yeah, for
Yeah.
sure. You know, I mean, that's like if you want to relate it to sports, I mean, would you rather take somebody with talent who doesn't try or somebody with mediocre talent that works their butt off, you know? So,
Good point. What did others think?
I think I think this actually reminds me of one of the readings that we had for the Summer Institute.
Which reading?
Mindset.
Okay.
Where they actually where they actually talk about the fixed mindset and the growth mindset. For some individuals, they may believe that they're born with some talents and they don't need to try. It just comes to them naturally. But the reality is, even though you'll be born with talent, if you don't really put them into practice, you may get stuck. But if you have a growth mindset, then you know that you actually have to try. And you gain understanding and depth through practice. And the more you practice, the better you get at it.
Okay. What did others think? Thank you.
Well, we were kind of along the same lines. We kind of took it as, especially in our profession, our job really isn't ever done. So like when you leave today, this work isn't done. This is the beginning of it. So we're going to continue and progress and go through to make things better every time we do it.
It's a good point. Climate and culture is never done. Like, there's never a point where it's like, okay, our climate's done. It kind of grows. What did you make of the part that says it takes moral clarity? What did that mean? Or what does that mean?
Would add on to what Ryan was saying too. You have to have the right mindset in order to be able to stay diligent enough and want to continue to work at something when it's a struggle, when it's much easier to give up.
And all of the things really in leadership, when you are not clear about the direction that you're heading, it becomes so confusing, you know, for everyone. So we really, as leaders, I have the responsibility to make things very clear to people that I work with so that they would not second guess about where we're heading in terms of the goals that we have set for ourselves.
Okay.
So that it is.
And I would say, piggyback what you just said, that's the clarity part. And I think you have to have a center of righteousness in terms of what are you doing? Is it moral? Is it fair? Is it something that people can see that's good for everyone? So with that clarity comes that other piece, this moral righteousness.
You know, one thing that I thought about when I read that is the question that comes to mind is, what do I stand for as a person? And you have to have like a moral code of conduct. What do you stand for? And what you stand for guides everything that you do. It has an impact on the people who you work with.
Can you give an example?
Well, the one thing that I did about 2 years ago, I did a moral code of conduct for myself. I have it at home, where it says I am a person of, and there's a word that I use for each one. I have about 7 I am statements. So I look at that each day. And what I do is I reflect on those. Am I doing these? And if I'm not, then I need to go back and reflect on it and make those changes.
What do others think of this? You know, when Ben was here, right? Margaret, I know him very well. One of the things that people always get at his school about is their insistence on walking the line. Can you talk about that at all? Even in the high school, until you're a senior, you walk in lines, and some people feel a certain kind of way about it. There's those that do. There's actually a really good video where they explain this so much. The more clarity around that isn't just about, like, so there's one camp of people who think, oh, that just is, trust students, you're preparing them because you think they're out of control, all kind. And the other part is like, without that kind of moral clarity about like what's right and wrong in this, like it could go haywire. And they haven't, even though they have a lot of critics around that, they haven't changed that, right? Now, do I think it's a good thing or a bad thing? I don't know. Like, as a school leader, when I was a teacher, kids all walked in lines. When I was a school leader, like, it was the last thing that I could get around. I wanted them to come to school and, you know, to treat each other civilly. And so that was our focus. But it goes back to what Kevin is saying there. You derive your leadership from a set of internal principles. And the clearer you are about that, like we saw that with your culture definitions yesterday, that will get transmitted and amplified to your staff. Martin raised an interesting point. He said there's a lot of confusion in the work. What do other people think about that? And what causes that confusion? Differences of opinions? About what?
So, basically, what's best for kids, you know, I mean, you and I may have different opinions on what's really best for the kids. And that's pretty much it, just like different directions, different ways to go.
Okay. What else? What causes this kind of confusion?
Lack of vision.
Lack of a vision? Okay.
If your leader doesn't have vision that he or she is communicating to the staff, then everybody's just kind of doing their own thing and it's going awry.
And I would say lack of clarity on that vision. So, because even if we have a vision, it's not clear to everyone. It's not going to be executed.
I think just in our experience, we had a good plan. Everyone understands the plan. It's the execution piece.
Okay.
So if you're, you know, not diligent and you won't track it and monitor it and make it part of every single thing that you do, then it strays. Because unfortunately, adults, they'll revert back to what they know, and that generally is not what you want them to be doing.
Everyone reverts back to it. Our work, especially if you're in a turnaround situation, where does it fall on the continuum of complex and simple?
I would say extremely complex.
Complex? What do others think? Complex? Tanya?
Well, we did
Yeah. As educators.
simple.
It's simple? Say it. Say more.
We teach kids. We inspire kids. I mean, maybe some of the common core and all of that is tough, but if you break it down to a kindergarten level, it's easy.
Mm-hmm.
You know,
Yeah. I think you're onto something. The work can be complex for sure. You know, getting a student to learn, especially like take a student like at St. Coletta, preparing them for life. You know, you have some clarity around it, you have direction. Yes, it's tough work. What if you replaced in this quote, instead of better as possible, saying simplicity is possible?
Did you say simplicity?
Yeah. What would that mean in terms of instead of better?
I don't think simplicity is possible. I think if simplicity was possible, then everyone would do it.
Then everyone would do it,
Yeah,
right?
I mean, I think the challenge of the position we're in is extremely non-simplistic.
Yep.
Every day is a new challenge. Every day is different in some ways. Now, if we have certain levers or certain ways that alleviate some of that, then that's fine. But still, I mean, you can ask probably the best principal around, is this simple? They're going to say no. I mean, they're going to say no. I've worked hard, and every single day that I have is still a hard day. What I'm doing every single day, and I love it, and I love the work. But it's not easy teaching kids. It's not easy dealing with stakeholders. It's not easy dealing with facilities. It's not easy putting out fires.
Easy or simple?
It's simple.
Okay.
It's not simple. I mean,
What's your response?
I don't agree.
Rules?
I we have a lot of stuff that we gotta do, and it's just a part of it. But the reality is we can do it, it's not, I don't know how to say it.
Wait, Julio wanted that.
I hear that also too, like I've felt that way, and when I hear the feeling of when I'm saying what's wrong with adults, I'm looking at myself in the mirror because it's my fault. Because I'm not communicating, or I'm not saying those expectations high, or I need to dig a little deeper and find different avenues for them to do certain things.
Yeah.
When it comes to that.
I think that part is key in why it wouldn't be simple, is how to deal with people that differ from you and change them without having them realize they're being changed, and get them to do what your mission is without having them understand that they're even doing it because you want them to, but they're doing it because they want to. That's what makes it not simple for me, at least. Is trying to guide others in a way that makes them feel as though it's their idea.
Well, what students do we always remember? I mean, I always remember those ones that I've spent hours and hours and days with when it comes to it. And that's to me, nothing simple about that. Nothing is easy about it. Whatever it is that comes to that. But I remember those relationships and building those students up, or parents up, or teachers up, that we've spent hours and hours developing and things like that. And I don't see the simplicity in that at all. I mean, if there was simplicity in that, then I think that we wouldn't have a shortage of teachers going around, or shortage of principals going around in Northeast Ohio. Or, I mean, it's an extremely difficult job when it comes to, in my opinion.
Ben?
Like, I think it's, most of the things are simple, but they're not easy.
Okay.
Like Scruggs was saying, if a situation comes up, every now and again there comes a situation where you're like, I don't know what to do. But in most situations, you know what to do. But we work hard. Like, this is not an easy job, and that's what Julio was saying. You know, basically, most of the stuff is very common sense, and what we've been taught, we already know what we're supposed to do. It's just maybe not that easy to do it.
I think it's very difficult having 50 staff members on board with your vision 100% of the time. If that was the case, then the simplicity would be there. When your staff members, your students, and your parents are there. I haven't seen a school like that in my career, going to top schools to any other school around. I mean, you have that constant, and that's just, and that not including the external factors that take place when it comes to different aspects. But I think that this quote more deals with, in my opinion, don't be afraid to make mistakes when it comes to this. Better is possible, but you may have avenues in which you have speed bumps on there, rather than the roadblocks, have the speed bumps that are going to happen.
Willie?
I kind of agree with Ben. It's. I think we make things tougher than they actually need to be, by the emphasis that we put on certain aspects of our job.
Do you have an example of where you've made something tougher than it needed to be?
Yeah, the OIP plan that we just did. You know, I just getting into it just made it a lot tougher. You know, trying to come up with multiple strategies for goals, and instead of just saying, okay, let's simplify this and have 3 goals and maybe 2 strategies for each goal. You know, I had 6 or 7 strategies for every goal, and knowing my mind as I'm creating, you know, how are you going to get this done?
Yeah.
You know, realistically, you know, you have to think of more of us, you know, making it simple and working smarter, not harder.
Yep.
So I just think that sometimes we just make things more complicated than they have to be.
Yeah. This idea of complexity and simplicity is one that we're, oh, sorry, Mark. Go ahead.
Yeah, I kind of have a different take on it.
Okay.
I try not to look at it in terms of complexity or simplicity. I'm looking at it from the standpoint of mindset. I think it really depends on the way that we the way that we think about what we do dictates everything that we do. And what I mean by that is, if we set our mind on something, and we know, and we're convinced that we're gonna get to that, it really doesn't matter what happens along the way, as long as we focus on what it is we wanna achieve. So the mindset to me becomes so critical in terms of looking at whether it's simple or complex. I don't know if I'm making sense.
Yes.
I think yes, the term mindset is actually, when you dig deep into it, it's actually it's an elegant concept. Like, it makes sense, especially the stuff around fixed and growth mindset. The science behind it is incredibly complex. And what Angela Duckworth has been able to do is simplify it so that we can wrap our heads around it, right? So if you got into the science of mindset, because it's both neuroscience, it's biological sciences, it has a lot to do with both internal and external stressors. Like, once you are into the science, the PET scans that they were doing on rats, the studies that they did of orphans in Coast Cobra and now adults, all the trauma that kids experience in Southside Chicago, all of these things that kind of went into that body of work. It's extreme. Like, so why do some kids who experience trauma excel and others are just kind of seemingly beholden to it, right? All of that is really complex stuff, and especially when you get down to the science of it. Like, as I'm reading the actual science that went into her work, I'm thinking, oh my gosh, is it really possible to overcome this? Like, if your brain gets wired because, it's trying to protect itself from bombings, right? Can you overcome that? A group of our psychologists went through, PTSD training, because they diagnosed that as one of the reasons why we're seeing some really violent behaviors among a subset of students. And when they traced it back, these kids had two things in common. One, they were shaken or dropped. Whether it was purposeful or not, it's beside the point. It happened. And the second is they experienced such, like, witnessing parents murdered and all kinds of really horrific things. And you kind of wonder, in the very, like, can you overcome that, right? The answer is maybe, and likely you can. But what they had to do is take all of that and say, all right, what do we do with it, right? So this idea behind complexity and simplicity is really important. Our work is inherently complex. How we talk about it and how we wrap our minds around it, that's where the simplicity comes in. And one of the things and so I think both Julio and Tanya are onto something on the, like, acknowledging I'm sorry, just gonna do that. I think Mark went to go get something, so I just share it over here. But on the complexity side, yes, if you've ever had a non-reading 10th grader, it's a difficult road to get that kid to read versus, like, a second grader. Right? But when you understand, when you're able to take the science of, like, people call it reading recovery or whatever, and you're able to kind of turn it into programming process, that's the simplicity. And sometimes, and most of the time, we create overly complex systems to solve that make things more complex than get to simplicity. And this is the chief problem in school climate. As leaders, when we go to build climate, and this is especially true of novice principals, right? Or people who just kind of haven't figured out that you actually have to do something important with climate, not just let it happen. They go for a simple answer. All kids walk on a painted line without really understanding why did that happen, right? No talking in the lunchroom. Have you ever seen this one? This is the weirdest one I've ever seen. Like, I walked into school, kids are eating in silence. Eating for us, both culturally and socialization and socializing, right? And then you rip that out of there. And so I'm like, why did you do that? And they're like, because it creates order in the cafeteria. Actually, a lot of research suggests what creates order in the cafeteria is the quality of the food. And I saw it firsthand in our comprehensive high schools in Washington, D.C. And
We've never seen this, right?
this is, well, look, we hadn't seen it either, right? And first of all, I didn't know that kids would eat fresh vegetables in high school. Like, you know, usually my experience is they chuck them off the side and go for pizza. I'll tell you what, we ran this experiment where we worked with a company called Revolution Foods, and now they're all into their organic kind of farm to cafeteria stuff, which is expensive. But so we ran a study, and so for 2 months, we fed one high school, very similar, all demographically similar. We fed one Revolution Foods and the other the commissary pizza, corn stuff. Discipline rates during lunchtime dropped 90%. And when we went to go talk to the kids about it, we were like, you know, cafeteria seems really settled. And they're like, yeah, you know, we're just eating. That's what they said. They were and so like you can break it down, right? But if you look behind all of that, there's a lot of science that suggests that. Think about when you've been to a restaurant and had a crappy meal. You want to stay?
No.
Make you particularly social? No, you want to get out and go. Same thing with kids. And so one of the things that we'll do today when we look at 4 dimensions of school climate is they're going to look simple. And more than that, they're going to look familiar. So familiar, an initial reaction might be, oh, we got that. We've been talking about safety for 20 years. You know, I've been in classrooms for 25. I got safety down. Oh, we're going to talk about, you know, like all that kind of stuff. It's going to seem like old hat, but what I want us to be able to do is embrace both the complexity in safety and figure out how to get towards simplicity. And the simplicity is not to be simple-minded, but it's actually a strategy for building your climate in the school. Right? If you come out like something like PBIS, some good science behind PBIS. I've seen PBIS implemented well, implemented kind of well, and not implemented at all. And it's a strategy lots of schools use. The biggest problem with it is that if the leader and school culture doesn't actually support that, it's the wrong strategy, right? You can't have positive behavioral supports when all the adults are negative, right? It just never works. And that's what I've seen a lot. But that means you're not valuing the complexity of the content. So that's the point here. So as we're going through these things, the moment you kind of get this trigger, oh, that's old hat, or I got that, think for a moment about the complexity that sits behind it. Okay, so we're going to watch a video. You guys, anyone here a fan of TED Talks? Oh, yeah, I'm a big fan of them. Okay, anyone else? Oh, by the way, do you guys know who Atul Gawande is? No? He is probably responsible, he's a surgeon. He's probably responsible for saving more lives in the entire world than any other surgeon, without ever conducting one medical procedure. The field of surgery, really complex, right? And there are lots of things that can happen during surgery. You can get an infection. Infections kill more people than the surgery actually itself, right? And so what Gawande figured out is how to stop infections that really kill people, and was able to do that in hospitals throughout the world. So we're gonna watch a TED Talk with Gawande. He says a lot of other things, and we'll try to take some lessons to it right before we jump into climate. Okay. And I hope that this is going to show up here. The audio should.
start in writing. A question of how do we all get good at what we're trying to do? It's hard enough to learn to get the skills, try to learn all the material you have to absorb at any task you're taking on. I had to think about how I sew and how I cut, but then also how I pick the right person to come to an operating room. And then in the midst of all this came this new context for thinking about what it meant to be good. In the last few years, we realized we're in the deepest crisis of medicine's existence due to something you don't normally think about: how you do good for people, which is the cost. That now is asking whether we can afford what doctors do. The political fight that we've developed has become one around whether it's the government that's the problem or is it insurance companies that are the problem. And the answer is yes and no. It's deeper than all of that. The cause of our troubles is actually the complexity that science has given us. In order to understand this, I'm going to take you back a couple of generations. I want to take you back to a time when Lewis Thomas was writing in his book, The Youngest Science. Lewis Thomas was a physician writer, one of my favorite writers, and he wrote this book to explain, among other things, what it was like to be a medical intern at the Boston City Hospital in the pre-penicillin year of 1937. It was a time when medicine was cheap and very ineffective. If you were in a hospital, he said, it was going to do you good only because it offered you some warmth, some food, shelter, and maybe the caring attention of a nurse. Doctors and medicine made no difference at all. That didn't seem to prevent the doctors from being frantically busy in their days, as he explained. What they were trying to do was figure out whether you might have one of the diagnoses for which they could do something. And there were a few. You might have a lobar pneumonia, for example, and they could give you an antiserum, an injection of rapid antibodies to the bacterium Streptococcus if the intern subtyped it correctly. If you had an acute congestive heart failure, they could bleed a pint of blood from you by opening up an arm vein, giving you a crude leaf preparation of digitalis, and then giving you oxygen by tent. If you had early signs of paralysis and you were really good at asking personal questions, you might figure out that this paralysis someone has is from syphilis, in which case you could give this nice concoction of mercury and arsenic, as long as you didn't overdose them and kill them. Beyond these sorts of things, a medical doctor didn't have a lot that they could do. This was when the core structure of medicine was created, what it meant to be good at what we did, and how we wanted to build medicine to be. It was at a time when what was known, you could know, you could hold it all in your head, and you could do it all. If you had a prescription pad, if you had a nurse, if you had a hospital that would give you a place to convalesce, maybe some basic tools, you really could do it all. You set the fracture, you drew the blood, you spun the blood and looked at it under the microscope, you plated the culture, you injected the antiserum. This was a life as a craftsman. As a result, we built it around a culture and set of values that said what you were good at was being daring, at being courageous, at being independent and self-sufficient. Autonomy was our highest value. Go a couple generations forward to where we are, though, and it looks like a completely different world. We have now found treatments for nearly all of the tens of thousands of conditions that a human being can have. We can't cure it all. We can't guarantee that everybody will live a long and healthy life. But we can make it possible for most. But what does it take? Well, we've now discovered 4,000 medical and surgical procedures. We've discovered 6,000 drugs that I'm now licensed to prescribe. And we're trying to deploy this capability town by town to every person alive in our own country, let alone around the world. And we've reached the point where we've realized, as doctors, we can't know it all. We can't do it all by ourselves. There was a study where they looked at how many clinicians it took to take care of you if you came into a hospital as it changed over time. And in the year 1970, it took just over 2 full-time equivalents of clinicians. That is to say, it took basically the nursing time and then just a little bit of time for a doctor who more or less checked in on you once a day. By the end of the 20th century, it had become more than 15 clinicians for the same typical hospital patient. Specialists, physical therapists, the nurses. We're all specialists now, even the primary care physicians. Everyone just has a piece of the care. But holding on to that structure we built around the daring independence, self-sufficiency of each of those people has become a disaster. We have trained, hired, and rewarded people to be cowboys. But it's pit crews that we need. Pit crews for patients. There's evidence all around us. 40% of our coronary artery disease patients in our communities receive incomplete or inappropriate care. 60% of our asthma, stroke patients receive incomplete or inappropriate care. 2 million people come into hospitals and pick up an infection they didn't have because someone failed to follow the basic practices of hygiene. Our experience as people who get sick, need help from other people, is that we have amazing clinicians that we can turn to, hardworking, incredibly well-trained, very smart, that we have access to incredible technologies that give us great hope. The little sense that it consistently all comes together for you from start to finish in a successful way. There's another sign that we need pit crews, and that's the unmanageable cost of our care. Now, we in medicine, I think, are baffled by this question of cost. We want to say, this is just the way it is. This is just what medicine requires. When you go from a world where you treated arthritis with aspirin that mostly didn't do the job, to one where if it gets bad enough, we can do a hip replacement, a knee replacement that gives you years, maybe decades, without disability, a dramatic change. Well, is it any surprise that that $40,000 hip replacement replacing the 10-cent aspirin is more expensive? It's just the way it is. But I think we're ignoring certain facts that tell us something about what we can do. As we've looked at the data about the results that have come as the complexity have increased, we found that the most expensive care is not necessarily the best care, and vice versa. The best care often turns out to be the least expensive. It has fewer complications, the people get more efficient at what they do, and what that means is there's hope. Because to have the best results, you really needed the most expensive care in the country or in the world. Well, then we really would be talking about rationing. Who we're going to cut off of Medicare, that would be really our only choice. But when we look at the positive deviants, the ones who are getting the best results at the lowest costs, we we find the ones that look most like systems are the most successful. That is to say, they found ways to get all of the different pieces, all of the different components to come together into a whole. Having great components is not enough, and yet we've been obsessed in medicine with components. We want the best drugs, the best technologies, the best specialists, but we don't think too much about how it all comes together. It's a terrible design strategy, actually. There's a famous thought experiment that touches exactly on this. They said, what if you built a car from the very best car parts? Well, it would lead you to put in Porsche brakes, a Ferrari engine, a Volvo body, a BMW chassis, and you put it all together, and what do you get? A very expensive pile of junk that does not go anywhere. And that is what medicine can feel like sometimes. It's not a system. Now, a system, however, when things start to come together, you realize it has certain skills for acting and looking that way. Skill number one is the ability to recognize success and the ability to recognize failure. When you are a specialist, you can't see the end result very well. You have to become really interested in data, unsexy as that sounds. One of my colleagues is a surgeon in Cedar Rapids, Iowa, and he got interested in the question of, well, how many CT scans did they do for their community in Cedar Rapids? He got interested in this because there had been government reports, newspaper reports, journal articles saying that there had been too many CT scans done. He didn't see it in his own patients. And so he asked the question, how many did we do? And he wanted to get the data. It took him 3 months. No one had asked this question in his community before. And what he found was that for the 300,000 people in their community, in the previous year they had done 52,000 CT scans. They had found a problem. Which brings us to skill number two a system has. Skill one, find where your failures are. Skill two is devise solutions. I got interested in this when the World Health Organization came to my team asking if we could help with a project to reduce deaths in surgery. The volume of surgery had spread around the world, but the safety of surgery had not. Now, our usual tactics for tackling problems like these are to do more training, give people more specialization, or bring in more technology. Well, in surgery, you couldn't have people who were more specialized, and you couldn't have people who were better trained, and yet we see unconscionable levels of death, disability that could be avoided. And so we looked at what other high-risk industries do. We looked at skyscraper construction, we looked at the aviation world, and we found that they have technology, they have training, and then they have one other thing, they have checklists. I did not expect to be spending a significant part of my time as a Harvard surgeon worrying about checklists. And yet what we found were that these were tools to help make experts better. We got the lead safety engineer for Boeing to help us. Could we design a checklist for surgery? Not for the lowest people on the totem pole, but for the folks who were all the way around the chain, the entire team, including the surgeons. And what they taught us was that designing a checklist to help people handle complexity actually involves more difficulty than I had understood. You have to think about things like pause points. You need to identify the moments in a process when you can actually catch a problem before it's a danger and do something about it. You have to identify that this is a before takeoff checklist. And then you need to focus on the killer items. An aviation checklist like this one for a single engine plane isn't a recipe for how to fly a plane. It's a reminder of the key things that get forgotten or missed if they're not checked. So we did this. We created a 19-item, 2-minute checklist for surgical teams. We had the pause points immediately before Anesthesia is given immediately before the knife hits the skin, immediately before the patient leaves the room. And we had a mix of dumb stuff on there, making sure an antibiotic is given in the right time frame because that cuts the infection rate by half. And then interesting stuff because you can't make a recipe for something as complicated as surgery. Instead, you can make a recipe for how to have a team that's prepared for the unexpected. And we had items like making sure everyone in the room had introduced themselves by name at the start of the day, because you had half a dozen people or more who are sometimes coming together as a team for the very first time that day that you're coming in. We implemented this checklist in 8 hospitals around the world, deliberately in places from rural Tanzania to the University of Washington in Seattle. We found that after they adopted it, the complication rates fell 35%. It fell in every hospital it went into. The death rates fell 47%. This was bigger than a drug. And that brings us to skill number 3, the ability to implement this, to get colleagues across the entire chain to actually do these things. And it's been slow to spread. This is not yet our norm in surgery, let alone making checklists to go on to childbirth and other areas. There's a deep resistance because using these tools forces us to confront that we're not a system, forces us to behave with a different set of values. Just using a checklist requires you to embrace different values from ones we've had, like humility, discipline, teamwork. This is the opposite of what we were built on: independence, self-sufficiency, autonomy. I met an actual cowboy, by the way. I asked him, what was it like to actually, herd 1,000 cattle across hundreds of miles? How did you do that? And he said, we have the cowboys stationed at distinct places all around. They communicate electronically constantly, and they have protocols and checklists for how they handle everything from bad weather to emergencies or inoculations for the cattle. Even the cowboys are pit crews now. And it seemed like time that we become that way ourselves. Making systems work is the great task of my generation of physicians and scientists. But I would go further and say that making systems work, whether in healthcare, education, climate change, making a pathway out of poverty, is the great task of our generation as a whole. In every field, knowledge has exploded, but it has brought complexity. It has brought specialization. And we've come to a place where we have no choice but to recognize, as individualistic as we want to be, complexity requires group success. We all need to be pit crews now. Thank you.
So what you guys think? Excellent. Why?
Because I think that, he started off talking about the cowboy and how doctors were very similar to those.
What was it about the cowboy?
That they had a lot of freedom, autonomy.
Autonomy.
People think, when you're a cowboy, you do your own thing.
Mm-hmm.
And so he started with that whole premise. Did he?
Start to pull up. Who wants to play again? And I don't know what's going to play. Okay.
So
Sorry to interrupt.
Yeah, he started with that whole concept and then broke it down and started talking about, doctors themselves. And so I thought that was very good. And he started talking about the 3 things. So,
Yeah, we'll get into those 3.
yep.
Great. Other reactions? Yes.
I think the biggest part of it, and I was listening to these two say the same thing differently, complexity is just about how you break things down, and you just said it too, and it's, I think, wrapping our mind around that. So if we have something that's complex, like you said, the OIP, breaking it
when smart boards first came out, that was when I started consulting. I would go into more schools where smart boards were just, and teachers would even put borders around them. They were just another place to hang student artwork or something on them. Now it's much different, but it's because like they didn't know how to use them. What else?
An interesting, like, it's kind of off topic of this, but about technology and smart boards. Dr. Phil Ward last year said that technology like smart boards makes good instruction better and bad instruction worse. And I always kind of thought that was really interesting because it's totally true. If you go into a classroom, if you have a good teacher, they can go off with amazing, cool stuff with technology, and if you have a bad teacher, they just rely on it, you know, whatever.
What else did you take away from TED Talk? Yeah.
I just made my pit cruise.
Oh, say more about it.
I'm all about, okay, okay, that's what I need to do, let's get it done. So, taking some of the load off of us so that we can, accentuate our, staff members' areas of expertise and becoming specialists so that each staff has an area that they're, you know, either good at or really want to be good at. So creating pit crews in different areas where people can kind of take more of a leadership role so that we can become better in more areas at a faster rate.
Right. So, what's the image of a pit crew to you? Like if you've watched, Formula One, like what does a pit crew do?
Well, I feel like they are kind of like the team leaders and kind of the trendsetters in those areas. So for instance, if we had a
Hold on. Go back to like the actual car example of a pit crew.
pit crew in a car.
Yeah, like in a racetrack. During a race. Have you seen a
How
pit
they
crew?
just run up to the car and fix it and then
Yes.
keep going.
Talk about that a little bit more. What do you see? They run up to the car, they do something, and then that car goes out. We're actually going to watch a video. of it.
They're focused. They're focused on not the problem. Everyone has their job, right? Everyone has a specific
Someone puts on the
job.
tires, someone puts on the bolt.
Right.
Someone brings the gas pump out, someone actually pumps it, right?
Right.
They all have these interconnections, but they know how to pump better than anybody else. They know how to put the bolts on better than anyone else or take them off, right? Right. So how does that relate to your idea of a pit crew?
Well, just exactly what I was trying to say is it'll help us grow faster. So we're saying we want to go from this level to the next level. We want our kids to do this, but there's so many different holes, and everybody's always trying to do everything. But if we have people that specialize in certain things that can help us, like, okay, we see that screw is loose over there. We got a pit crew that's on it. What do we do? Maybe they can help us to formulate the formula for success,
Yeah.
or at least a little bit of growth in that area.
Yeah, remember the pit crew means all of the people who have specialization come together at one time and then they go off, right? Versus the cowboys who are highly specialized and autonomous.
So the pit crew to me mean putting an education program as the RTI program.
Oh, say more about this. Is interesting.
I mean, it just everyone's coming together, focusing in on one car, aka student, and bringing forward the information forward and what they're going to do to help the student in one way or another. So if it's working in a specific reading, if it's working in specific math, if it's working in behavior aspects, but we have all of our support staff coming together and each one of them gets on the same page with their part to help that one situation out.
Why not cowboys?
Just lack of communication. You could have 5 cowboys working on the same thing, and what's that going to solve?
It turns out at the end of the day, cowboys have checklists too. What do you guys think of the checklist?
I rely on checklists for everything, so it's just a mental organizer, like you said, to ensure that nothing's overlooked, nothing's forgotten. I mean, they even put the little pauses in there intentionally to ensure that stood out to me more than anything is that sometimes those teams come together and it's the first time they've ever worked together.
Yeah.
You know, we have an opportunity to work with people, you know, for, you know, several months, you know, if we're going to a new place, or for some of us, you know, I think of Julio. I used to work at the Northwest campus. They've been together for so long. I mean, at this point now, it can be a well-oiled machine, you know, and I think that that's something that we need to strive to get to, you know, as we're putting our figures together. You know, who's the expert? How do we use them? And how do we organize it? How do we as the leaders ensure that the checklist is followed and everybody has what they need
Well, how
to
do
do
you
their job well?
How do you ensure that? One, so first about the checklist, right? Short, doesn't have everything. Do you remember the language that he used? Like what goes on the checklist? He said it in very dire terms.
So it's a reminder of things that we sometimes often forget.
That's right, and he says they are killer points. So what goes in the checklist are things that could kill someone, whether it's in aviation, whether it's in skyscraper construction or surgery, right? What goes in the checklist is not every little thing, which sometimes we can confuse. It's like what will kill you, right? And for us, like I hope I'm not going to kill anyone, but it's a reminder to take the complexity. This is an example of taking the complexity and get into simplicity using a filter of what's most critical. Right? So your checklist, long, short, in between?
You know, it depends. I think that there are times that I get really deep in the weeds and put more than needs to be on there, and I think it complicates the process.
Yeah.
You know, and there are times where it's efficient. You know, and so it kind of depends.
Okay.
So not to set up a fence, but you know, there are times when it's like nailed it and we accomplished it, got through it. There are times when it's like, you know, we're really sweating things that, okay, we'll move on.
Yeah. Mark?
Well, I'm gonna use a different take on things. But anyway,
Okay, what's your take?
what stood out for me, I see a conflict of value systems.
Okay, say more.
And what I mean by that is, there seems to be a very clear dichotomy between what we're trained to be in terms of values, individualism, and the new trend that would actually minimize what we may view as complexity. We're actually trained to be independent, to feel like we can do it on our own. That's the value system that we train on. But the challenge that we really do have nowadays is to understand that this value system is not going to be as effective with the kind of issues that we're dealing with, given the idea of complexity. So to minimize that, I think we have to rethink this value system and understand that complexity could actually be minimized through working together. I understand that each and every one of us has some kind of unique gift in some areas, that if we bring that to the table, that would actually minimize what we see as complexity.
And in the quote before, that underlies the moral clarity, right? The value system, right? So he starts off with a talk by saying, let's talk about what happened early in medicine, right? Your treatment was directly related, and to some cases now still is, to how much your doctor knows, right? If your doctor knew to think, oh, you might have syphilis, that's why you're getting paralyzed, then, they'd mix up arsenic and mercury. Like, that just seems outlandish, right? Two things that will kill you in a second. But could help with paralysis, right? And if the doctor knew how to, check, look at the blood under a microscope, all of that stuff, all the lone dog stuff. And certainly there's still some of that, like the teacher goes in the classroom and shuts the door. Right? Do we still, I mean, how are your schools structured? Are there teams of teachers in a classroom? Yes?
Yeah, for portions of the day, yeah, there's more than one adult in every room,
Okay.
especially with literacy instruction.
And they're working together like a big group.
That's the goal. Some are much better than others, that is for sure.
I think what you're saying is right, like we're in a transition, right? But it's up to the leader to decide that. Like it could very well be the case, that you decide, you know what? I don't value collaboration, I don't value teamwork, and I think you ought to go to lunch. I think you're right, there's definitely been a tradition of like a teacher as a specialist, and we've gotten even more specialized. We have reading specialists, math specialists, we have we have special educators, right? You ask me, one of the biggest problems in special education is that we have special educators, and that we have it, and that we believe that they know something more than other people. But in fact, like specializing learning like that is not so helpful. Now, when you get to things like occupational therapy, speech language pathology, those kind of things, you probably need a specialist. But I think he's asking us to say, the moment you see specialization, ask yourself the question, is that good for the system or not good for the system? Sometimes specialization would be really good. He's not saying no specialization at all, but he is saying as a pit crew, we bring those specializations together for a common purpose to make something happen, right? That you, like specialists just don't operate in their own world. The other big question, the other big concept he brings up is a system. He says there are 3 parts of a system, any system. Do you guys remember what that is?
Recognition of success and failure.
Okay. Okay.
Devising solutions. And the ability to implement the systems.
Okay. Okay. To recognize success and failure, what is the tool that he says that they use at least in medicine?
Data.
Data. Okay. We're familiar with that, right? Yeah. All right. All right. Devising solutions. What is the method that he says there? He gives us 2 things that we think are the right things to do, but actually aren't. You remember what he says? Yeah, we bring more training. So we think when we have failure, 2 things he sees that happen a lot. The first response is people need more training. People probably need more training like they need another ear. Like it's one of the easiest things to devise. It's probably one of the least effective, right? He says there's another thing that we do when we see failure. He says we bring technology. Oh, computers in the classroom. That's what's going to help, right? Instead, what does he say? You guys remember what he says? Instead, he says we need to look for the simple things. Remember, like we have all this medicine, and those medicines have an abysmal success rate compared to just washing your hands, right? So he's saying before you jump into that, he's like, look for the simple things. And he also says the simplicity is captured in like a system or a process, like a checklist. Was anyone surprised at the success of the checklist in medicine? It's truly revolutionized. Now, when he went to do this, he wrote a whole book on this. It's called the Checklist Manifesto. You should pick it up. It was when I was at the district, my chief of staff, he was totally into this guy, and he started to do these checklists for all of the procedures that we have in the special ed system. It really changed the so much so, like we got down to the 30 a month. Also on Medicaid, I don't know if you guys know much about that, but the way Medicaid reimbursement happens is we ask Medicaid for reimbursement, CMS, and then they send us money, and then at the end of the year there's this reconciliation, and almost always there's what's called a clawback. You submitted something you shouldn't have, or you didn't do it the right way, and CMS for Medicaid services takes it back, right? Our clawbacks, our recruitment was sometimes like 20 million. Our clawbacks could be, 25 million. Yeah, it's because
take more.
yeah, because then they would go back into some, past years and say, oh yeah, you did a similar thing there, so we're going to take that money too, right? We reduced clawbacks to zero. Just by a simple checklist. It was just in the process. I mean, anyone filled out a Medicaid reimbursement form for students, it's dizzying. It's as if someone doesn't want you to get the money, right? So that's where a checklist and a discrete procedure for it. Next, he says the last thing is your ability to implement. This is probably the toughest one. We're going to talk about implementation tomorrow. I want you to think for just a second. On a scale of 1 to 10, 10 being the highest, of you and your school are great implementers, and 0, you have implementation failure. This is called your IQ, your implementation quotient. Where are you? If you think about the number of initiatives that you launch in a year, how successful are they? You launched 10 initiatives one year. How many were off the chart successful? You don't have to answer that, right? The ability to implement, to actually take the checklist and get it to happen in a context, in culture, is really difficult. When he first brought the checklist to hospitals, his colleagues were running him out. In the book, it explains all of the stories and the backstories of how they actually got the checklist to live. One of the biggest reasons, one of the biggest places of pushback on the checklist came because they were asking nurses to stop the doctors when they weren't doing something right. Why was that pushback?
It's like humility, which is what he was saying there, and the lack of thereof.
Yeah, well, what's the usual roles for doctors and nurses? Doctors say do and nurses do, right? Not the other way around. What this caused, though, were speed bumps for the physicians. So they weren't leaving surgical instruments inside of their patients, right? Which turns out many nurses have caught doctors leaving and said, hey, you might want to take that, I just like to say there's a scalpel storm, you want to take that out. But they were specific there. Like, in your own processes, like, who is that who says, sometimes as leaders we can't see, we either see the trees or we see the forest, and we're not good at both. But who is that, right? And that all goes to the ability to Wande's whole point is to say medicine, and he said education as well, and other sciences, all very tough and complex. But we can bring simplicity, and I think this is where Tanya and Julio were together. Before we go on both sides of it, before we go on, this is a quote that I've always loved. This is from Oliver Wendell Holmes. He says, I wouldn't give a fig for the simplicity on this side of complexity, but I would give my life for the simplicity on the other side of complexity. This means I won't be simple first. I'll acknowledge the complexity. And in his day, fig was a euphemism for some other things, right? So after the break, we're going to dig into school climate. And what I'd ask you to do is to keep in mind both things at once, both simplicity and complexity. And really ask yourself the questions without going to simplicity first on this side of complexity, but really looking at the complexity involved in what we do around safety and what we do around all of the teaching, learning, all kinds of things. Look at that first and then work backwards towards simplicity. Likely if we do it the other way, we'll be simple-minded and we'll have simple-minded answers. Okay? Does that make sense? All right, let's take a 15-minute break and be back exactly at 9:30. Okay, thank you. No problem. Yeah, I know. You know?
You know, as I was driving, there's 3 fire trucks, and it was 2 police cars in front of the shoulder.
Yeah.
Wow, it was bad.
No problem at all.